Hey there, thanks for watching today's video. I'm Dr. Tyler Williams with Better Sleep SLC, and you're here because you're looking at some remedies for snoring, or ways to stop snoring, or ways to improve your snoring. Or maybe you can't sleep in the same room as your bed partner, or your spouse, or your significant other, or your family, kids. Maybe it's hard to go camping or stay overnight with friends because you're embarrassed about the snoring. You might be keeping everybody awake, right? Other people contact us because they have what we call silent snoring, is the nickname. More common in females, but sometimes in men too, and that's where you'll gasp or stop breathing for maybe just a few seconds every few minutes or a few times an hour. And it doesn't necessarily make that loud sound, but there are some health problems attached to it. Okay, so a few things to consider. Okay, why do we snore? Why does it all of a sudden show up, especially when we're adults? Okay, where could this come from? So, there are a couple areas that we'll focus on here that talk about this, right? But the main thing to know is, there's genetic components, there's life impacts on how and why you snore, right? So the first one is, your genetic component, which would be more like your anatomy, and that can be small airway, small mouth, large tongue. Okay, so or if you're really muscular, if you have a big muscular neck, that can encroach or push in on your mouth and your tongue and make it so there's less room for your airway. So if you look in the mirror and you say you want to look at how much of your airway can you see. If you can't see any of it, you might have a large tongue or small mouth or some combination, right? You might be able to see a lot of your airway, but maybe you're just losing elasticity on the roof of your mouth. So we see a lot of people who have had missing teeth or lost teeth, or they had braces done years ago where they would pull teeth out, which we don't do as often anymore. And if you or your kids are ever suggested to have a bunch of teeth removed from braces, I would suggest getting a second opinion just to make sure, because most of the time now that's not the best way to treat that. But with a small mouth or a large tongue, even if you have a normal sized tongue and your mouth gets smaller from losing teeth, now your tongue doesn't have as much room or places to go, so when you lie on your back, it gets in the way. All right, so that's kind of the anatomy, or just kind of how your body's built. Okay, can be one option. All right, the other one can be lifestyle. Okay, so drinking, smoking, okay, those kind of things we know aren't great, especially if they're done later in the day. Okay, drinking lots of caffeine later in the day, eating lots of sugar, refined foods later in the day. And by later in the day, I usually mean around after 7, 8 o'clock, something like that for eating. As far as caffeinated things, much later than mid-afternoon, 3 o'clock or so, has been shown to throw off our sleep or make you just completely exhausted. When you're too tired, then you can have more issues with snoring, not sleeping as well, not feeling as well rested. Okay, and then of course diet and exercise fall into that lifestyle as well. Okay, so if you have excess weight, you've gained weight recently, that could be muscle or fat. Many times it's being overweight is causing it, but it can also be if you've started lifting a bunch of weights and your neck got bigger. Whatever happens around here, be it muscle or especially fat, it will kind of start to squeeze in a little bit, and it gives our throat less room and tongue less room. Okay, to keep those in mind. Now when you're, a lot of times kids will have their tonsils out, and depending which sleep physician you ask, that may or may not help with snoring. We haven't seen a lot of evidence that it helps with adults. Same with if you have sinus issues or a deviated septum. I had a septum surgery where my septum was crooked, fixed. Now, I didn't get that to treat sleep apnea, but it's something that probably wouldn't help it anyway. I can breathe better during the day, but if I had sleep apnea or snoring, probably wasn't going to help that as much, right? So, the facts of 1, your anatomy, 2, lifestyle, okay, 3, and then what are you doing to make your sleep better? Okay, if you have loud snoring and you've done all these things and you're in good health, you may consider an oral appliance or a CPAP or some type of surgery, which could include an implant. Our niche in our office is we make mouth appliances, oral appliances that people wear for snoring and sleep apnea, and they work really well. They also protect your teeth. They're comfortable. Most people can get used to them, and you can wear them whether you've had implants or dentures or you have all of your teeth. And those coupled with some of the other options I mentioned, also sleeping position, bed, okay, taking things into consideration like not staying up late watching movies or being on a device, because the more device time, the more blue light you have, the more likely you are to not fall asleep as easy, and it can cause some issues. Even making sure your room's cool and dark at night. You don't have a bunch of blue light and white light. You kind of want warmer tone lights. Has been shown to be more conducive to a sleep environment. So we hope these things have helped you, and we hope that you can find some remedies for your snoring. If you have questions on this, please call or text us. Our contact information is below, and we will look forward to seeing you on the next one. So have a great day, and we'll see you soon. Thanks.